Hello guys, this video is about loan for medical expenses. Can you get or can you apply for a medical loan? Yes, you can apply for a medical expenses. If you do not have money, then or you have ill or you are suffering from any disease, then you can apply for a medical expenses as a medical loan. Managing healthcare costs. Slide. This was slide 1. And loans for medical expenses. Our title is Healing Finances Loan for Medical Expenses. Overview is I will focus on using loans to cover medical costs. Slide 2, it is about the rising cost of health. The rising cost of health. Point 1 is discussing the increasing expenses associated with medical treatments. And the second point is the financial strain on individuals and families. Slide 3 is importance of medical expenses loans. The importance of medical expenses loans, highlighting the role of loans in providing financial supporting during medical emergencies. Point 2 is ensuring access to necessary health care without immediate financial burden. Slide 4, it is types of loan for medical expenses. If you are going to apply loan for medical expenses, there are types of medical loans expenses. Overview of different loan options for covering medical cost. If you will go to a company or bank or anywhere from where you want to get a loan, you can ask them which different loan options are you offering for the medical expenses. It is personal loan, medical loan and credit loans. Slide 5, it is personal loans for medical expenses. You can get personal loans based on medical expenses. For this, first point is discussing the use of personal loans to cover medical bills. Discussing the use of personal loans to covering medical bills. Point 2 is unsecured nature, interest rates and repayment terms. What are the personal loan for medical expenses? It is unsecured nature, interest rates and repayment terms. Slide 6, it is about medical loan for specialized lenders. Exploring loan specially designed for medical expenses. Point 2 is features, benefits and considerations. Slide 7, it is credit cards for medical payments. You can use credit cards for medical payments. Discussing the use of credit cards to manage medical costs. Point 2 is evaluating interest rate and potential benefits. You can evaluate interest rates and potential benefits. Slide 8, it is about qualifying for medical expense loans. Understanding the eligibility criteria for medical loans. You have to understand what you have to understand. It is eligibility criteria for medical loans. If you want to apply for a medical loan, then you should know about the eligibility criteria. What is the criteria for the medical loans? Factors. Point 2 is factors influencing approval and loan amount. Slide 9, it is interest rates and terms. What are the interest rates and what are the terms? Point 1 is explaining interest rates and repayment terms associated with medical expense loans. Point 2 is fixed versus variable rate and loan duration. If you are applying for a loan, for a medical loan, you should know about fixed and variable rates. You can ask from the company or from the bank from where you are getting loan. You can ask them what are fixed and variable rates and what is loan duration. Slide 10, it is collateral requirements. What are the collateral requirements? Discussing whether medical loans require collateral. Point 2 is variation based on loan type and lender. Slide 11, it is about applying for a medical expense loan. How you can apply for a medical expense loan. Step by step guide on applying for loans to cover medical bills. You should know the step by step guide on applying for loans to cover medical bills. Point 2 is documentation requirements and application process. Slide 12, it is quick approval and disbursement. Point 1 is highlighting the quick approval and disbursement process for medical expense loans. Point 2 is ensuring timely access to fund during emergency. Slide 13, it is financial assistance programs. Point 1 is mentioning existing financial assistance program for medical expenses, and the point 2 is grants. You should know about grants, charity care and government assistance. Slide 14, it is budgeting for medical costs. Point 1 is encouraging proactive budgeting for medical expenses, and slide point 2 is planning for potential emergencies and unexpected health issues. Negotiating medical bills. Tips for negotiating and reducing medical bills. How you have to negotiate for reducing medical bills. Communication with healthcare providers and exploring options. You have to communicate with the healthcare providers and explore options, and you have to explore options, what are the best options for you. Slide 16, it is understanding insurance coverage. Point 1 is the role of health insurance in covering medical expenses. Point 2 is knowing policy details and potential out of pocket costs. Slide 17, it is the impact of credit scores. The impact of credit score. Point 1 is discussing the impact of medical loans on credit scores. Point 2 is responsible borrowing and its effects. Slide 18, it is medical expense loan versus emergency fund. Okay, point 1 is comparing the use of medical loans, comparing the use of medical loans to having an emergency fund, evaluating financial preparedness for unexpected medical costs. Slide 19, it is loan repayment strategies. What are the strategies for loan repayment? Strategies for managing repayment of medical expense loans: budgeting, prioritizing payments, and potential refinancing. Slide 20, it is about case studies, successful medical financing. For this, our first point is real life examples of individuals successfully using loans for medical expenses. Point 2 is overcoming financial challenges during health crisis. Overcoming financial challenges during health crisis. Slide 21, case studies, lessons learned. Examining case studies during examining case studies highlighting challenges and lessons learned in medical financing. And the point 2 is the importance of early financial planning. You have some early financial planning. Slide 22, it is the role of medical expense loans in chronic conditions, discussing how medical loans can support individuals with chronic health conditions. Point 2 is long term financial considerations. Slide 23, it is post surgery and post treatment financing. First point is the role of loan in covering post surgery and post treatment expenses. Point 2 is ensuring continued financial support during recovery. Slide 24, it is about accessibility of medical loans. Point 1 is highlighting the accessibility of medical loans for various health care needs. Point 1 is outpatient procedures, dental work, and elective surgeries. Slide 25, avoiding medical debt. Tips for avoiding excessive medical debt, early financial planning, and potential care. Slide 26, it is legal and ethical considerations. What are legal and ethical considerations? What you can consider as an ethical and legal terms. Brief overview of legal and ethical considerations in medical financing. Point 2 is compliance with healthcare and lending regulations. Slide 27, it is about resources for financial assistance, providing resources for individuals seeking financial assistance for medical expenses. And the point 2 is government programs, non-profit organizations, and local assistance. Slide 28, it is about telemedicine and virtual care financing. Point 1 is the role of loans in covering costs associated with telemedicine and virtual care, adapting to changing healthcare delivery models. Slide 29, it is about medical tourism and financing options, discussing the use of loan for medical tourism, and it is financial travel and treatment expenses. And slide 30, it is all about conclusion. You have to keep in mind all the points, all the key points if you want to apply for a medical loan. Encouraging responsible use of medical expense loans and financial planning for healthcare needs. Thank you guys for watching this video.